My name is Allison Gertz. My friends call me Allie. I live in New York. I'm 23 years old, and I have AIDS.
Today is the 30th anniversary of World AIDS Day. We have come a long way from the fear, stigma, and ignorance that defined the HIV epidemic in the 1980s.
My illness was traced back to one sexual encounter that I had 7 years ago. I was 16 years old and in love with an older man. This man had since died of AIDS, something that I'd been unaware of all these years. AIDS was not an issue at that time.
Since the beginning of the epidemic, more than 70 million people have acquired HIV, and 35 million people have died of AIDS-related illnesses. But science and global solidarity have helped us turn the tide on the epidemic.
It was here at the United Nations that the urgency of a global response to the AIDS epidemic was uniquely recognized on October 20th, 1987. For the first time in history, a health issue is discussed on the floor of the General Assembly.
Let us not underestimate the challenge before us. A worldwide effort will be required to stop AIDS. And yet we must win this global war.
New infections have dropped by almost half since 1996, and AIDS-related deaths are down by more than half since 2004. But HIV is not over. Of the 37 million people estimated to be living with HIV, 75% know their status and 60% are being treated. That's an improvement, but it's not good enough. In the Sustainable Development Goals, the world has committed to ending the AIDS epidemic by 2030. To achieve that target, we're calling on everyone at risk of HIV to know their status. Nearly 1 million people still die every year from HIV because they don't know they have HIV and are not treated, or they're treated too late. But today, we have better tools than ever before to diagnose and treat HIV. WHO recommends HIV self-testing, which is especially important for reaching the most vulnerable people. Ultimately, the best way to ensure everyone can get the health services they need for HIV is for every country to progress towards universal health coverage. No one should get sick and die from HIV just because they are poor. Health for all means HIV testing for everyone at risk. This World AIDS Day, know your status. I thank you.